We'd like to welcome you all today to the first of our educational programs that are going to be hosted by Taylor Regional Hospital here at the Cancer Center. We would like to thank Atlanta Oncology for providing us with the space to do our program today. And the first program we're going to be hosting is What is Diabetes? The program today is going to be presented by Mr. Gary Burch, and he is a registered pharmacist. And he is going to bring us some wonderful information about diabetes and about early detection, and if you are diagnosed, what you can do to help control your diabetes symptoms and manage it with your exercise and diet and things such as that. So at this time, I'd like to ask Mr. Gary if you would come on up and get us started, and we appreciate that.
Oh, sure.
And I hope you all enjoy.
If just call me Gary. If you call me Mr. Gary, that's what my wife tells me when I'm in trouble, so I kind of tense up, or Mr. Burch, and that's what I do. I get speeding tickets, so. I got one in Loyola County. But I talked it down, though. All right, what is diabetes? It's a disease which you all know is characterized by high blood sugar. And it's resulting from a defects in insulin not working, not having enough insulin, or both. And that's type 2. In type 1, there actually is no insulin at all in the body. And actually, diabetes means the flow of urine. And they used to diagnose people by the taste of urine, because diabetes mellitus means the flow of sweet urine. There's another endocrine disorder called insipidus. It's a growth hormone, ADH deficiency, where you have the urine is real bland because they just keep producing urine. Now, before we talk about what the abnormal process is in diabetes, let's talk about what the normal process is. Well, the body actually knows the levels of blood sugar what they need to be. And if you want to think of the pancreas as sort of like a thermostat, instead of controlling temperatures, controlling blood sugar, it actually, the pancreas does a lot. It detects the levels of blood sugar and releases insulin in response to bringing down the blood sugar. And insulin is absolutely necessary for the sugar to move out of the bloodstream into the tissues. And then cells use glucose for energy, and the blood sugar brings back to normal. So again, it's like a thermostat. The blood sugar goes up, the pancreas detects that, releases the insulin to get the blood sugar back down. And we got a graphic on this. Okay. Now here we have the visual. We have the red tube structure, of course, is a blood vessel. And the little squares represent the carbohydrates. The carbohydrate, it's just hydrated carbon. That's another term for just sugar or glucose. So you have after a meal, you have the blood sugar going up, and the blood sugar goes to the pancreas. The pancreas, again, like a thermostat, releases insulin. So the insulin is kind of like it's like a gate. It's like a secret code. So without the insulin, the sugar stays in the bloodstream. But then the insulin sort of activates a code, unlocks a door, and then the sugar comes out of the bloodstream into the organs, mainly the liver and the muscle primarily. Now, what happens when the blood sugar gets low? Okay, if the blood sugar is low, again, the pancreas does something to bring the blood sugar back up. It releases a hormone called glucagon. And where the sugar is stored in the body is the liver. In fact, in the morning when diabetics get puzzled, say, well, it's been overnight, I haven't eaten anything, I have a high blood sugar. Where does that come from? What's happening is the liver is leaking out sugar. And anyway, so there's in diabetes, there's an imbalance between glucagon and insulin. And the understanding of diabetes is more sophisticated than it was many years ago, and some of the therapies actually address that. And as the liver releases that sugar to bring the blood sugar back up, that's the process, and that's really key. Now, there's a condition called prediabetes. If you want to think of this, type 1 and type 2, type 1 used to be called juvenile diabetes or insulin-dependent diabetes, because the only therapy for type 1 is insulin, since the body makes no insulin. And type 2 is gradual. Type 1 usually happens very quickly, and they think now, the thinking is that they have some sort of an infection, a viral infection, and it's an autoimmune disease. So when the body's fighting the infection off, the immune system actually attacks the pancreas and destroys the cells in the pancreas that produce insulin. Well, type 1 diabetes is sort of like pregnancy. You're there or you're not. Okay? Type 2 is gradual. And in type 2, there's a condition called prediabetes. And the prediabetes is where you have a fasting blood sugar greater than 100 or less than 125. They have an increased risk of developing diabetes. I've seen numbers from, I think, 30 to 50%. People may develop it, may not. Now, with prediabetes, I also have increased risk of heart disease and stroke. And exercise and weight loss, this tremendous amount, can delay the progression to diabetes. In fact, they did a study with exercise and diet. I think there was about something like a 30 to 40% reduction in diabetes, and maybe even more than that. There's a study on it. Now, hyperglycemia, we'll go through this very quickly. This is for fasting blood sugar. And a normal fasting blood sugar is 70-100, and we don't need to belabor on that. I think everybody understands that. Now, the criteria for diagnosing diabetes. The hemoglobin A1C. What is the hemoglobin A1C? Well, it turns out the hemoglobin is the oxygen, red pigment in the bloodstream before it gives meat the red flavor from M&T meats. That's a plug. I didn't get paid for that, but airlines go there. Anyway, the hemoglobin actually has some sugar on it. It has a normal percentage of sugar because the sugar reacts with the hemoglobin. Well, they use that as a test, and since red blood cells last for about 2 months, that's a good marker for like quarterly measurements of blood sugar for progress or for monitoring the disease. Well, actually, now in the last few years, the ADA, the American Diabetes Association, has used that for diagnosing diabetes. And for diabetics, it's one thing they use to make a progress. It's like a 24/7 picture of their blood sugar the last couple of months. That's one criteria, and that's probably the most common because it's a one-time stick. Or a fasting blood sugar 126 or more on 2 separate days, or 2-hour plasma glucose greater than or equal to 200, or random plasma glucose of 200 with symptoms. So the new thing is the A1C has been recently used to diagnose it now, and they didn't before. Okay, most of diabetics are type 2, which is the progression from pre-diabetes to type 2. Now, sometimes with weight loss and exercise, there's a lot for diabetes. When I said that that you need insulin, when muscles are exercising, they do not need insulin. And that's back when people exercise briefly, their blood sugar will drop. So before people exercise, they really need to check their blood sugar. And the kind of the red flag that's over 250, then they need to, they may not need exercise. Non-insulin dependent diabetes is a former term, is the old term, but now it's type 2. And it's usually about 90% of those that are diabetic. And type 1 is the type that's rapid onset. They usually have a medical crisis of diabetic ketoacidosis. They have the fruity breath, all the nurses know that, and they go into a coma because what happens is the blood chemistry, the acidity of the blood becomes too acidic. That can affect the heart, and it's just a crisis, and they have to have live IV fluid, insulin until they're normalized. So it's a life-threatening situation. Now, unless anybody is interested in this, let's kind of skip through this really quickly because I think probably type 1. In type 1, again, no insulin is made because the autoimmune the beta cells. So the beta cells are the islets of Langerhans. What they are, the little, if you look at a tissue sample of the pancreas, it's the little islands of the pancreas that actually make the insulin. It occurs in childhood and adolescence. Sometimes people usually, when adults are diagnosed, it's usually young adults or children. And they're prone to a medical condition called ketoacidosis. And what happens in that is to burn carbohydrate, the body has to have, let me back up. To burn fat, the body has to have carbohydrate. And what happens is when the body doesn't have enough carbohydrate to burn, it keeps burning fat in an abnormal way and produces these things called ketone bodies. And they're acidic. And that's where that fruity breath, they say it smells like rotten apples, and the blood pH drops. People that used to go on these low-carb diets, sometimes they'd actually check their urine for ketones. In the Atkins diet, and there's always been a controversy about that diet. I don't know what the current position on that is. And this is just a graphic to show that, again, the arrows represent insulin, the yellow represent body tissues, and the little squares are just blood sugar being bridged into the tissue cells. Now, the strange thing about diabetes, we'll get to that in a minute. Let me hold off on that statement now. And the normal fasting blood sugar is considered 70 to 100. Now, in type 2, it's a little more complicated than type 1 to understand. You have a condition called insulin deficiency, and there's something else called insulin resistance. And that's kind of a hard concept to sort of understand, and we'll get back to it now. Some characteristics of people who are type 2 are they usually have the apple shape. There's two kinds of body fat. There's the belly fat or the visceral fat. That's more unhealthy. That fat actually releases substances that cause blood pressure to go up, more insulin resistance, you need more insulin to work, and blood pressure problems, cholesterol problems. So the visceral body fat, the pear shape, is unhealthy. The apple shape, pardon me. The pear shape is where they have the large derriere, and that's a different kind of fat. That's the subcutaneous under the skin fat. But the visceral fat actually is metabolically active to worsen diabetes. Now, type 2 is frequently undiagnosed for many years. There's no medical crisis. Now, the exception is you can have there's a type of, if the blood sugars go above 400 to 600, they can develop a coma where the brain is kind of dehydrated and they go into like sort of a gradual falling asleep and coma. But that's not common. Now, the risk increases with age, being overweight, and lack of exercise. And type 2 has a strong genetic predisposition. Now, what insulin resistance is, I want to talk about that. That really is the body's need for insulin. Okay, and you say, what do you mean by that? Well, let's say a patient was started on insulin therapy for type 2. And they were taking, say, 20 units of insulin in the evening. And they lose 10 or 15 pounds. All of a sudden they have these low blood sugar episodes and wonder what's going on. What's happening? They have less insulin resistance. Their body needs less insulin. So their body is working better to use the insulin it has. It's kind of like gas efficiency. So things that cause insulin resistance is you get more overweight, you get sick, pregnancy, those things should make your body need more insulin and the medicines go up. As people lose weight or exercise, it makes the body use the insulin more efficiently. Does that make sense? And that's a real key part of type 2. The risk factors: obesity, age 40, family history, and some ethnic groups: African Americans, Hispanic, Native Americans. I think there's a group of Pima Indians in Northwest America. They have an incidence of like 50% diabetes. If someone's had a history of gestational diabetes, they're more at risk. If they have high cholesterol or high blood pressure. Now, saying that, when someone is type 2, not only are they treated for their blood sugar, but blood pressure and cholesterol. A lot of the damage that diabetes does, which we'll talk about, is blood vessel damage. So somebody that has diabetes is going to usually take medicines for cholesterol and blood pressure, because it's a vascular disease. And again, this slide is just re-emphasizing the process. You have the tissues, and the insulin is required for that blood sugar to get out of the bloodstream into the body tissues, primarily the liver and the muscle. And if the insulin is not there or not working, then really diabetes is kind of a paradox. It's like starving in the midst of plenty. And one of the symptoms I'll talk about is people with diabetes will have is polyphagia. They'll eat a lot. It seems not to make sense. Why would somebody be hungry and have high blood sugar? The reason is, even though there's plenty of sugar in the bloodstream, it can't get out of the bloodstream into the tissues for nutrition. And this is just sort of a flow chart on the way etiology just means cause. Everybody probably knows that here. Diabetes. And in type 1, there's no insulin. The pancreas is lost its ability to make any insulin. In type 2, there is insulin deficiency. And it's been estimated that when people are diagnosed with type 2 diabetes, that 50% of their pancreatic function may be gone. So, and it's depending on the doctor that people in type 2, they can start on insulin early. They might not need it at all. But again, with type 2, the good thing is Jenna was talking about, exercise and diet can do a lot. Because with exercise, it makes the body more insulin sensitive. It uses the insulin better. And the weight loss makes, got what I'm saying, it's the camera pressure. But with the exercise, it makes the body more insulin sensitive. And the weight loss can actually, and sometimes people actually either able to lower their dose of the blood sugar medicines or even come off of them sometimes. Now, the symptoms of high blood sugar, they call it the 3 Ps. Increased thirst, polydipsia, urination, polyuria, increased eating. Now, if you read about it, they actually, before they had insulin, people that had type 1 would drink gallons and gallons of milk. What happened is when the blood sugar gets so high, there's a threshold above which the kidney cannot filter out sugar. What happens? So the sugar spills into the urine, pulling water with it. So they just they just cannot satisfy the thirst. They urinate so much volume, they have to drink so much. Now the increased eating is like we alluded to just a minute ago. How can you be hungry when you have a high blood sugar? Well, the reason is the sugar from the bloodstream is not getting to the tissues for nourishment. So they're eating all the time. So it's kind of like, it's starving in the midst of plenty. Tiredness and fatigue, they're really not getting the nourishment from they have. The blurred vision, what happens in the blurred vision, and sometimes blood sugar goes up or not, or down, is the lens in the eye is, the thickness of the lens is subject to changes in the thickness by the blood sugar going up or down. It's kind of the osmotic effect. So people that have a high blood sugar, their vision may start to have blurriness, and that's a symptom of high blood sugar. Sometimes people lose weight, sometimes they gain weight, they lose weight. Now, recurrent infections and sores that don't heal. This is something a lot of people don't know about. High blood sugar is toxic. When you have high blood sugar, it actually weakens the immune system. It weakens the white blood cells response. So people that have diabetic, they'll have infections that don't heal. And everyone's heard the horror story of someone losing their foot or their leg. Well, diabetes is the perfect storm for amputation. You have poor circulation, high blood sugar, which nourishes the bacteria, and the high blood sugar also does what? It weakens the immune system. So all those conditions are just opportunistic for an infection where people have gangrene or lose their toes or feet from diabetes. And also have a numbness or tingle in the feet or hands, like falling asleep, a paresthesia. the high blood sugar will damage the nerves. We'll get into that a little bit later too. I mean, another slide on that. So they have neuropathy, and that's another condition where people can lose their feet because they can't feel anything on the floor if their foot is cut. Again, this is just a cartoon. Excessive drinking and eating, excessive urination. People might go to the bathroom several times a night. Weight loss or weight gain, and general itching and infections in women. Women will get yeast infections a lot of times, and it's pretty easy to see with high sugar in the urine and a weakened immune response is opportunistic for yeast infections or fungal infections in women. And impotence in men, again, that's a vascular issue. The blood vessels are affected, and it's not uncommon for men to have that with diabetes. But y'all so quiet. I mean, okay. Again, another graphic, the blurred vision, slow healing cuts or sores. A lot of times, patients with diabetics will get cellulitis a lot of times. I have a friend that's diabetic, and he's got cellulitis several times, and you're shaking your head. And because that just goes with it. The high blood sugar, weakens the immune system, it's opportunistic for the bacteria, and poor circulation. Again, the numbness or tingling in the hands or feet, the neuropathy. And they've improved a lot in that. A lot of times they'll start people on a medicine called amitriptyline, but now they have some other drugs. You've seen them advertised. Being a pharmacist, I'm embarrassed to say they advertise a lot for neuropathy injection. Anyway, that's a common problem with patients who are diabetic. Again, the dizziness, weakness, drowsiness, and in extreme cases, there's hyperglycemia molar. There's a condition, diabetes in type 2, where people's blood sugar goes above, I think it's like 500 to 600. The brain actually dehydrates, so they can go into a coma, and that's a dangerous condition. Okay, now, saying all that, what are the causes of high blood sugar? Too much food, especially food, carbohydrates. Bad thing is diabetes has terrible consequences and complications. The good thing is there's a lot people can do. It's not easy. It's very challenging. I mean, in the South, how do you what are the three staples? Salt, sugar, and fat. And all those are not, good for anybody. But with carbohydrate counting, it's really effective because what's recommended and to do by several of the diabetic organizations, if you imagine your plate is, half your plate is, say, crunchy vegetables, which are free carbs, like tomatoes, crunchy vegetables, broccoli, something like that, and then that's half your plate. A fourth of your plate is your meat, a fourth plate is starch. Instead of when you go to a steak place, where there's a baked potato, a meat, and then a bowl of salad about that big. Anyway, that's what's recommended. So carbs is one thing. If you're not having the dose of medications is not high enough, or you've skipped your diabetes medications. Stress and illness. What happens in stress and illness is the body makes hormones, stress hormones. And what they do, they actually cause the body's blood sugar to go up. And so a lot of times when people check their fasting blood sugar, if it's fasting blood sugar is going up, it may be an early symptom they have an infection. Because again, the steroids, because if you ever have bronchitis, people have had that, will give you an antibiotic and a steroid. The steroids your body makes will make the blood sugar go up. Less than usual or little physical activity. Again, the more you exercise, the more insulin sensitive you are, the less insulin resistant you are. As people get more sedentary, the body's not using insulin as efficiently, and the blood sugar is going up. And other medications such as steroids, like if you get a mineral dose pack, a Fred pack, or something like that, that'll make people's blood sugar go up as well, because they cause the body to make glucose. Now this is a slide showing the areas of complication, and it's sort of a tour around the body. The eyes, glaucoma, blindness, and cataracts. They don't really understand, to my knowledge, unless Skip knows differently, how it causes cataracts or glaucoma. But diabetes, the main thing, one thing to take away with, is to tell anyone or for your families, it is a disease of blood vessels. A lot of times people are not diagnosed with diabetes until they get an eye exam, because they actually can visualize the arteries. So they can get progressive or non-progressive retinopathy. So they have little hemorrhages in the back of the eye. So yearly exams for eye exams for diabetics are critical. Stroke, diabetics, in diabetic patients, atherosclerosis is more aggressive. So they are more prone to thrombotic strokes where you have a clot. Heart disease. Heart disease is really has to be treated in diabetic patients to prevent it. Diabetes by itself is a risk factor for heart disease. And another frightening thing about diabetes with the nerve damage is someone with diabetes can have a silent heart attack. They will not feel the pain of ischemia from a heart attack or angina. So they can have a heart attack and not even know it. And the other bad thing is, in women, usually women before menopause are protected from heart disease or have less risk than men do. But diabetes is the evil equalizer. Women and men diabetics are at risk for heart disease. So the stomach, with neuropathy, you can get delayed emptying of the stomach. It's a term called gastroparesis. Probably everybody knows that here. So they might need something like Reglan to help the stomach digest the contents a little better. Also, they can get reflux. We mentioned impotence in men, circulation problems. They can get a peripheral arterial disease where you have the claudication in the veins and arteries where on exercise. You have pain, it's better with rest. The nerves are affected, they get neuropathy, they can't feel. A diabetic can cut their foot, get infected, and never know they cut their foot because they can't feel it, which we talked about the sensory thing. You can have autonomic disorders. The autonomic nervous system is the one involved in involuntary functions, breathing, digestion, things like that, the heart. And so with nerve damage, you can have even issues with the digestive system too. Kidney disease is a very serious complication of diabetes, but there are very effective drugs for kidney disease. In fact, ACE therapy is called ACE of kidneys. It's a wonder drug for kidneys. They not only do they lower the blood pressure, but they have an independent effect in protecting the kidneys. But if you go to a dialysis clinic, two conditions against the people who had high blood pressure and diabetes. But this is the one thing about it, I would say these conditions, these complications are preventable. And again, blood vessels, gum disease. And now there's association, I don't know if it's causal or not, where people with good dental health that floss, it may lower the inflammation that may be associated with vascular disease. Y'all so quiet. You ever been okay? Now, the causes of diabetic complications: small blood vessel damage, again in the kidneys, in the eyes, large blood vessels, heart disease and stroke, the nerve damage, and decreased ability to fight infections. And I'm sure it's sad to say, but probably everybody knows somebody here or knows of someone who lost a foot or a toe to an amputation. And again, the later complications can be serious. The retinopathy, the retina, of course, is the photographic film of the eye, and that can be visualized. And again, a lot of times, I'm sure y'all talked to someone that they did not know they had diabetes, so let's say I had an eye exam. Nerve damage to the feet, gum disorders, and something else I didn't mention too, skin disorders. there's something called acanthosis nigricans. It's like a darkening pigment on the skin. It has to do with insulin resistance. There's skin disorders, and also high blood sugar can dry out the skin too. It makes the skin really dry because it's pulling. As people have polyuria, it's just dehydrating the body. So you have to be very careful of dry skin, and what happens when skin gets dry, gets cracked. You can get what? Infected. So we have to be very careful. So where I taught we had a clinic where I retired from, a diabetes clinic, and we encourage people that if they're diabetic, what? Don't go barefoot and don't wear open-toed shoes. And although these complications are frightening, they are preventable. And again, it requires that they're not going to take medicines only for blood sugar, but for prevent heart disease. Myocardial infarction, again, I talked about silent heart attacks, congestive heart failure, high blood pressure. Peripheral vascular disease, the little yellow thing is showing the plaque in the arteries. Kidney disease, nephropathy, gangrene, and amputations. But all these, again, with care, proper care, prevention, therapy, are preventable. And how to delay or reduce long-term complications. Control the blood sugar with diet. Now, I will say on this slide, this is incorrect. Control blood pressure, this guideline has changed. At one time, the blood pressure guideline was less than 130/80. That has been revised to 140/90. And lower cholesterol level, a target of bad cholesterol of less than 100, regular eye exams for eyes and kidneys, and stop smoking. There's never been more options for people to stop smoking. Smoking is a terrible addiction. It's a difficult addiction to stop. But now there are side effects with Chantix. I think that people get terrible nightmares. But now there's more options than ever for people to stop smoking. Because diabetes with smoking and diabetes, it is just a double whammy on the blood vessels. Low blood sugar. Now, as you take therapy for high blood sugar, the risk is what? Having low blood sugar. Now, I will say this. The guidelines for patients' blood sugars are an agreement between their physician and the patient, because and there's some information always in these packets. These packets do not mirror what's in this slide, so I hope if you want to take them home and look at them. But anyway, the goals for people's blood sugar depends on how aggressive the physician or caretaker or provider and the patient want to be for that blood sugar. Because low blood sugar can cause, severe low blood pressure can cause seizures, and in some cases, heart attacks are possible. And it's not defined by any particular glucose level, but symptoms. Now, saying that, I will say that, symptoms are shakiness, sweaty, anxious, and headache. Well, I see that. The first thing I think is my wife's coming after me after something I've done in the kitchen. But anyway, it's really sort of a quick thing. High blood sugar is slow. Low blood sugar is bam.
I feel weak.
You do. You feel weak.
I keep glucose tablets.
Good. That's good, because when you're driving or doing something, you can actually lose consciousness or you lose your ability to make judgments quickly, so it's dangerous. And again, what happens is when the blood sugar gets low, it's sort of a fight or flight response for the adrenal gland, and your body's releasing epinephrine to kind of bring it back up. And during that time, your heart's pumping, you're sweaty. I mean, it just comes on right away, and headache. So that's good. And another thing you can have is raises. Now, if you take your blood sugar tablets, one thing to do is you want a high protein meal within a snack within an hour or two, or a meal, because the protein actually helps the body. I think it releases glucagon, and that helps bring the blood sugar back up too. But anybody that's taking any kind of therapy for diabetes always needs to have a low a blood sugar snack available right away. And the rule is, there's something, see if we have it on the slides. There's something called the 15-15 rule. Again, this is again, the palpitation, irritable. Again, the blurred vision. Remember I told you how the lens is subject to, the thickness is subject to changes in the blood sugar. It's an osmotic effect. Now, what can cause your blood sugar to be too low? If you skip meals, of course. Now, I tell patients when everybody's so rushed, and we were even talking about this, I think Jenna and Brandy were talking about, Jenna got to eat lunch today, and Brandy didn't. Because you really can't think of your body and eating like a car. The car's not on a clock. Your body's on a clock. And your blood sugar, your blood pressure, everything is going up and down all day long. So, and it's really challenging to do it, be disciplined, to eat regularly. But delaying meals, your body's going to react to that. Eating not enough. If you don't eat enough, if you exercise too much, again, the exercise will open up the muscles to the sugar, to pull the sugar out of the bloodstream. And sometimes too much medication, say you've lost 10 pounds, 10 to 15 pounds, I think it's like a 10 to 15% weight loss can produce tremendous changes in blood sugar control and blood pressure control. So sometimes that had to be changed. Drinking alcohol on an empty stomach is a no-no because that blocks the body's ability to make blood sugar to bring it back up. Now, with some medicines too, have you any questions about your medicines too?
Well, I'm on metformin.
That's terrific medicine. It's not one that drops your blood sugar too low, but it has tremendous benefits, and I think it's one of the best medicines I have for diabetes.
And I don't check my blood sugar. My doctor checks it with the A1Cs.
Okay. But that's what he recommends it. Now, to treat low blood sugar, there's something called the 15-15 rule. If you and also sometimes when your blood sugar is coming down, it's going to feel like you have symptoms because your body is readjusting to a new set point where it considers a low blood sugar. If you have symptoms, check it at 70. If it's less than 70, you want a 15-gram snack, carb snack. 15 minutes, and then recheck it. Now, if it's, say, usually 15 grams of carbs brings up your blood sugar about 30 points. So if you have a 15-gram snack and your blood sugar is 70, it's going to bring it up to 100. And say if you checked your blood sugar and it was 50, then you want about a 30-gram snack. Anyway, this is kind of a rule of thumb. It's called the 15-15 rule for blood sugar treatment. And again, I always have those blood sugar tabs with you because you know it happens so quickly. Now, if you miss a meal or snack, eat it now. Now, if the blood sugar does not come back up, then get emergency care. About anything that you want to ask about?
What exactly was the 15-15 rule?
Okay, let me back up then. The 15-15 rule, let's go back because I didn't really cover that as well as I could. It's that if check your blood sugar, 15 grams blood sugar, recheck in 15 minutes. 15 grams carbs, recheck in 15 minutes.
And that's if you're below
70. Yeah, below 70. And if it's, say, 50 or so, you probably need 30 gram low because 15 grams brings up the blood sugar about 30 points. Okay. Sort of as a rule of thumb. And yeah, when we encourage people like, I have a friend who's diabetic and he's done real well. He's lost 30 pounds and he's having a lot of low blood sugar, so I told him to have a box of raisins. He said that would work for him. And actually, and this is kind of beyond the purview of this talk, but when people do carb counting, what they learn to do is recognize carbohydrate serving in terms of 15 grams carbs, and do from that like a slice of bread is 15 grams of carbs. Now, your sick day rules, we talked about this. If you can't eat your usual meal. You want to have 15 grams of carb every hour, like fluids, because you don't want to get dehydrated. That's the key thing. And I know with the, and this is a recommendation, I know with the strips, insurance companies are difficult. I remember when we used to hand out strips. I try and give patients a little more than I could. We're supposed to. But anyway, because insurance companies are so restrictive of how often you can check your blood sugar. But you do want to monitor the blood sugar when you're sick a little more than often. Skincare. Okay, again, with diabetes, high blood sugar dries out the skin. Mild soap, lukewarm water, protect your skin. Avoid scratches. Wear gloves doing yard work. Again, you can cut yourself, not feel it, and you wouldn't know you were infected. Sunscreen, especially out here in central Georgia. I don't think I have to worry about frostbite, and treat injuries properly. Now, Johnny, the signs of infection.
Red, pus.
Mm-hmm. It's like angry, red, hot, swelling, throbbing, and pus, yeah. Because again, with cellulitis, it's not uncommon in diabetics, and sometimes they have to have a second, third round of treatment. Yeah, those are all the signs of the infection.
Going back to heart disease, I had bypass surgery. I wasn't diabetic. And during my rehab, I went had a dietitian talk to us. She asked me if I was diabetic yet. And I said, no. She said, well, you wouldn't be.
Well, you might have prediabetes. Because even with prediabetes and high blood sugars, there's blood vessel damage. So, because now, and it changed, because we were talking beforehand, in 1997, they changed the diagnosis of diabetes. So I would ask patients, if you had a family member that had heart disease in their 50s or 40s, or kidney disease, chances are they're probably diabetic, because the American Diabetes Association in 1997, they changed the line of sand. Before 97, the fasting blood sugar of, I think, 140 was considered diabetic. Now it's 126. So what they've done actually is include more people. So, but even with pre-diabetes, there's blood vessel changes. And actually, truthfully, this is kind of a little bit of speculation, but high carbs are probably going to be restrictions on carbohydrates by nutritionists in years to come, like there was for fat years ago. Now, with dental care, also it's more important to see with gum disease, because again, gum disease, your gums are full of blood vessels. So getting dental care, flossing, because the gum disease is associated with inflammation, and the inflammation, I think inflammation is sort of a buzzword or current line of thinking about vascular disease.
There was a period of time after I had my bypass surgery that the dentist wouldn't work on my teeth.
Yeah, because he was frightened of having complications. You go now, do you floss and everything now, or do you?
I brush.
Flossing is good.
No, I'm not.
After your heart surgery, would you work on
He just said that, the dentist said that the complication from infection or whatever, I mean, it was a number of months before he would clean my teeth.
Yeah, because again, and I just hammered home a point with diabetes, the poor circulation, high blood sugar. High blood sugar is toxic, and I'll say this: a lot of major hospitals now, when they have surgeries, they will they will put people on insulin. They're not diabetic to get their blood sugars down, because they'll have stress from what they've gone through cause them to have high blood sugar. They'll put them on insulin, bring their blood sugars down. Their healing times improve. They'll get out of the hospital faster. I mean, you wouldn't think of high blood sugar being, you said, well, sugar can be innocuous, but it is. It really does a lot. High blood sugar it's not good for the body. Now, diabetes is a balancing act, and it's challenging, because the bad thing is, it's so hard, because, the American diet is not healthful. I mean, there's fat, salt, in sugar. Mom, this turtle, it don't taste good. Put some more sugar on it, honey. Yeah, you know. So I mean, that's just this kind of mentality. And whereas I'd ask, and I've never been overseas, but in Europe, you know, say you walk in Europe and there's always fresh produce around, because foods that are just kind of a little chemistry, foods that are high salted or preserve longer, and but for the body they're worse. And actually something else too with diabetes is diabetics are really sensitive to salt, their blood pressure. So keeping the salt down really helps the systolic blood pressure come down a lot too. Anyway, that's concludes my presentation. Thanks for your patience and coming in the rain to see it. Y'all have any questions?
Well, I have one.
Sure.
Kind of. My grandparents went to their doctor, their family doctor, about a year ago, and he said that they were borderline diabetic, but they eat very healthy. They eat a lot of fruits and things like that, and he thought maybe that they thought the fruit might have caused them to be. They're not diabetic. They still aren't. Like he checked if they're yearly or whatever, and said your blood sugar came back kind of on the level. Can fruit do that? Can it I don't know.
Well, I mean, it's the choices. You find all kind of literature or information from the internet that's reliable and unreliable. Like some people say, well, if you eat acid and you put acid on your food, it'll improve your body's tolerance of sugar.
Yeah.
And but pre-diabetes is I don't have. If you look. He said, well, no, let's look at these handouts. Pre-diabetes is a broad spectrum. And so the 126 and the 6.4 is a threshold. So because again, it's not like type 1 is like pregnancy. You're diabetic or you're not. But people, and again, with exercise and diet, they did a study that I think it's like 40% with diet and exercise, people would not progress to type 2 with careful diet and exercise. So you can do a lot because what happens in pre-diabetics is they progress to diabetes, their body cannot tolerate carbs. And so, but when they exercise and restrict the carbs, because what it is challenging the pancreas to put out enough insulin. So again, there's a study from the 60s, there's a study where they look at it, the function of the pancreas at diagnosis. And at diagnosis, most people were type 2, they speculated from the study, and Skip probably could tell you better than me, they lost 50% of the pancreatic function. Now some type 2 diabetics will not need insulin and some will. And that's controversial. And I used to tell folks that when you get on diabetes, if you have insulin, it's not terminal.
Right.
In fact, insulin is the best, and insulins now are better than they ever have been. Because now the insulins, they have, it's more consistent, like with the new insulins, like the Lantus or glucosamine. They're consistent, and you don't have the low blood sugars like you do with the old insulin. Because what NPH, you would have stacking of doses and stacking of insulin, the absorption is poor. Because when you look at people go on pumps from the shots, because I'm a certified pump trainer with Medtronic. I never did it, but we went through the training. Anyway, one of the first things they do, they lower the insulin dose by 50%. Because the absorption of insulin is really erratic. In fact, with insulin therapy, they're actually supposed to do like a Z, because you can get all kinds of fat distribution problems, absorption problems, and things like that. But you see, it's the body's ability to handle the sugar and glucose. But with weight loss and with, again, the insulin resistance sensitivity, as it lose weight and exercise, your body uses the insulin better to control the blood sugar and handle it better.
With the old forms of insulin, bovine, pig insulin, people developed antibodies to their own insulin because of the admission of the old insulins.
Now it's used
they developed antibodies to their own insulin, as well as to the So the dosage kept having to go up and up in order to maintain them.
Yes, I mean, it's amazing
Because
because
you get fructose,
Yeah.
which is a sugar.
Which is a sugar,
Yeah.
right, and that's why,
Handled a little bit differently from glucose.
yes, yes. It just was strange to me that the doctor thought that they were eating too much fruit.
and there's something called too. I mean, this I don't know if this will help you answer, but there's a concept called glycemic index, and what that is, if I explain it, is you'll have, say, two foods that have the same amount of carbohydrates, but one food will cause your insulin to spike up higher than another food. And I don't really know how the American Diabetes Association is recommendations on that, but that is a term that where, because you'll have a spike of low blood sugar with more with certain foods than you will others, because it causes your body to produce more insulin. So it's a really a complicated thing.
Yeah.
But the exercise and it is really difficult when people learn to count carbs, because I think with diabetes they recommend 60 to 80 carbs per meal and a high protein source. But again, because usually it's breaking the train of what you're used to eating and doing what you're in.
Right.
But I think in like 10 or 20 years they're going to start restricting carbohydrate, recommending carbohydrate recommendations for patients as well as fat.
Okay. Interesting. Yeah, thank you.
I like your food groups.
Huh?
I like your food groups.
Fat,
Salt,
salt, sugar, yeah, that's right.
That's-
Southern staples.
It always makes it taste good.
Better too.
I used to tell students that that was the McDonald's recipe. When you went to McDonald's, that's what you got.
Yep.
That's right.
Well, the food companies, they're pretty slick. If you read it, they knew a lot of times it salt and sugar people, they eat more of it. Yeah. So it's a marketing thing.
It is.
Well, fresh peaches are coming out soon, so my wife is really excited about that.
Yeah.
So maybe she won't give me such a hard time.
Yeah, about that. That'll be good.
Well, appreciate it. Thanks to y'all for coming. And
Thank
again,
you.
this
Thank you.
Thank you.
and the information in there. This is from the National Diabetes Education Institute. And also, if you look on the back, I put some resources. There's some quizzes online.